The University of Maryland Children's Hospital is a valuable resource to Baltimore City and the entire Mid-Atlantic region, providing state-of-the-art primary, specialty, and critical care for children from birth to young adulthood. The Children's Hospital is located within the University of Maryland Medical Center at 22 South Green Street in Baltimore. Nationally and internationally recognized pediatricians have been part of the University of Maryland for more than a century. We provide care to children in more than 30 specialties, as well as primary and emergency room care. Today, University of Maryland Children's Hospital has 132 licensed beds and employs more than 150 attending and faculty physicians, as well as 111 residents and fellows. In late 2020 through early 2021, much of which was impacted by the COVID-19 pandemic, we had more than 3,000 admissions and more than 94,000 outpatient visits. Additionally, we handled more than 15,250 visits to the pediatric emergency department for a range of issues such as acute asthma attack, organ failures and infections, and behavioral and mental health issues. University of Maryland Children's Hospital surgeons performed nearly 900 inpatient surgical cases in addition to their nearly 2,000 operations on an outpatient basis.
We have always recognized that children are more than simply little adults, and that they have extraordinary needs as growing kids. We are able to offer the exceptional care we do because our hospital has been designed intentionally for children, and our faculty and staff, including our anesthesiologist, are specially trained in pediatric medicine. They are committed to providing not just leading-edge treatments, but also the compassion and intangible qualities necessary at a children's hospital that guide patients' abilities to heal from the inside out. Driven by a family-centered care philosophy, the pediatric nurses, allied health professionals, technicians, and child life specialists that round out our care team make our children's hospital the warm environment that facilitates hope and healing. The pediatric nurses contribute to the success of the entire University of Maryland Medical Center's efforts to improve patient outcomes. These stellar outcomes have earned the Medical Center the American Nurses Credentialing Center's Magnet designation, putting our hospital among an elite 3% of hospitals that have earned this gold standard designation at least 3 times.
The University of Maryland Children's Hospital is a regional referral center for more than 30 different specialties. For pediatric cardiology and heart surgery, the hospital ranks among the top 50 on the U.S. News and World Report's Best Children's Hospital list. The University of Maryland Medical Center for Advanced Fetal Care provides comprehensive heart care even before birth and continuing that care into adulthood. The hospital's Pediatric Hematology Oncology Division combats childhood cancers in conjunction with the University of Maryland Marlene and Stuart Greenebaum Comprehensive Cancer Center and the Children's Oncology Group. In addition to providing world-class cancer care, these physicians also have expertise in sickle cell disease, hemophilia, and other bleeding disorders. The University of Maryland Children's Hospital is also a key provider of primary care throughout the region with a special focus on the communities in West Baltimore. Throughout our partnerships with several Baltimore City schools, we bring preventive care directly to where the kids need it most. Our mobile health units routinely visit schools to treat patients with asthma and allergies, providing students with wellness information and conduct free health screenings. A large focus of the University of Maryland Children's Hospital is critical care. Our all-private room, 19-bed Pediatric Intensive Care Unit, or PICU, facilitates healing from major surgery, respiratory failure, or acute infection. Our Drs. Ruben and Violet Gigi Neonatal Intensive Care Unit is a 52-bed Level 4 facility that cares for premature infants. It is one of only 2 in the state of Maryland. The Pediatric Emergency Room is exclusively dedicated to serving the needs of infants, children, and teenagers. The 16 treatment areas provide a quiet and safe environment. The Pediatric Emergency Team cares for the evaluation and management of more common problems like injuries and infections, and more complex issues such as organ failure and respiratory disease, which may require admission. There is also a private area for pediatric sexual abuse program. The team also provides immediate access to subspecialty consultations as well as pediatric intensive care units. Additionally, there are 2 units for children and adolescents experiencing a behavioral or mental health crisis.
If those children need admission, the Child and Adolescent Psychiatric Inpatient Unit is a 16-bed, state-of-the-art entity designed both architecturally and clinically to deliver trauma-informed care for children 5 through 17 years old. Our team provides treatment to patients who have depression and anxiety, and others who have endured abuse, neglect, violence, school issues, and other traumatic experiences. The unit provides crisis stabilization, recovery, and healing to instill hope that life will get better. Post-discharge, school transition specialists work to connect patients and their families to vital services and peer support. This has proven to reduce readmissions.
Finally, our close relationship to the University of Maryland School of Medicine means that scientific and medical research is also a vital component of our children's hospital. We have a long history of exploring the fundamental nature of conditions that can undermine children's health, from asthma to cancer, HIV to teen violence, and heart conditions to neurological disorders. At the University of Maryland Children's Hospital, we have an acute understanding that our work is about investing in the future. But we also know that what we are doing has the potential to impact the lives of other children, not only in Maryland, but also around the world.